Now, staying in the UK, health experts have warned shortages of some medicines are putting patients at risk. Pharmacists say they sometimes experience abuse and anger from frustrated members of the public. Medicines to treat wide-ranging issues, including epilepsy, ADHD, cancer and hormone replacement therapy, are in short supply. We can speak now to James Davies, who's Director for England at the Royal Pharmaceutical Society. Thank you very much for coming on the programme.
Thanks for having me, Lewis.
So what do we know about what's going on here? What are the causes of some of these shortages?
Yeah, so we're seeing far more shortages at the moment, and particularly some more acute supplies, and they're caused by a variety of reasons. So on one side, we've got supply-related issues. So those are ones where we've had problems with either the raw materials going to the factories, the manufacturing facilities that are making these medications, but also we're seeing some challenges on the demand side, where for certain conditions, particularly ADHD is one good example that you've mentioned, where demand for those medications around the world has gone up and increased significantly. And as a result, that's leading to some acute shortages, and people in this country are struggling to get access to the medicines as a result.
Yeah, you mentioned one there, and I mentioned a couple, but just worth reiterating, what are some of the drugs affected here?
Yeah, so there's a variety of different drugs, but I think if we think about some of the disease categories or the areas that are affected, so HRT medication has been affected for many people. We're also seeing some of the diabetes medications that have been affected. For epilepsy, there's a few of the epilepsy medications that are in short supply at the moment. And indeed, some specific treatments for acute areas such as scabies treatment, which is again in short supply.
OK, and if you're watching this and do fall into one of those categories, what should you be doing?
So I think there's a couple of things that people should do, and we recognise that when you're short of your medication, especially for your complex long-term conditions, it's incredibly stressful for you and the people in your family if you can't access these medications. So the first thing to do is to go and speak to your pharmacist, go and speak to your pharmacy team, and understand whether your medication is in short supply or not. If it is, they may be able to help kind of guide you towards alternatives or give you a slightly shorter course of your medication until more of that supply comes in. The second thing that everyone can do, even for those medications that aren't in short supply, is where people are taking repeat medication for chronic conditions, is to make sure that they go and request those repeat medications as early as possible. And there's tools such as using the NHS app or making those requests in at the surgery, which gives both the doctor's surgery and the pharmacy enough time to try and make sure they can get the adequate supplies in place and to get those ready.
OK, and given that it is difficult to just ramp up production of these things for technical reasons, what are the changes? Are there any changes that you would like to see to try and manage this situation better?
So I think there's a couple of changes that we would. I think at the first level, we'd like to see the government, the suppliers, the pharmaceutical supply chains all coming together further to make sure that we're really understanding the problem and thinking about the solutions to stop these shortages happening in the first place. But beyond that, when the shortages do occur, we'd like to see more powers given to pharmacists to be able to solve them. So, for example, if you came in with a prescription for a 50 milligram tablet, at the moment, I could have the 30 milligram and the 20 milligram on the shelf right next to me, but I couldn't be able to supply those to you without getting a change to that prescription. And if you were in hospital as a pharmacist, I'd be able to make that substitution. But we'd like to see our pharmacists and community being able to make those changes to make it easier for patients to get access to the medicines that they need.
I see. James Davies, thank you very much for coming on the programme. Thank you.